Hello friends, Jeanice Mitchell, pelvic health physical therapist in Central Texas, and I'm joined today with Gerard Green. He's a UK-based physiotherapist, and I had the pleasure of meeting him in Denver a couple months ago in person. And it's always so much more fun to get to meet a person in person. So we had a great time, and I thank you for your time today. So would you like to say anything as words of welcome?
Yeah, so just a big thanks to Jeanice for the invite to come on the talk. I'm really honoured to be here. So I'm based in the UK in Birmingham, which is our kind of second city, and I see lots of female pelvic health, lots of male pelvic health, and I kind of share Jeanice's passion to really help as many men and women as I can, and also to get across to those men and women, regardless of where they live, that pelvic health can help with so many conditions and quality of life, and also to try and get more, I'm quite passionate about getting more PTs working in pelvic health.
Yes, 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 yes. And I think that the momentum is building. So when I first started, you know, back in 2000, because my first son was born in 1999, and that's why I became started specializing in this area. It was so few of us. So now people are understanding, and I think regular people like non-therapists are also thirsty for conservative, healthful interventions. They want to understand their body, and a lot of people have heard of their pelvic floor muscles. There's still so many people out there that haven't, but the awareness, and I think social media has been a really, really positive factor in the awareness. So if you aren't following us, I'll give a shout out to our two channels. So Gerard is at Harborn PT on Instagram. And how do they find you on Facebook?
They can find me on Facebook at Harborn Physio will come up as well.
Okay, so I'll put links to those. This is going to be on YouTube, so I'll put links. I think I can do that in YouTube in the caption. And then you can find us on Instagram, Mypelvicfloor Muscles, or on YouTube, Mypelvicfloor Muscles. So today our topic is female pelvic health conditions during COVID-19. So we know that Corona has rocked all of our worlds, and we've had to redefine what we're doing and how we're doing it and when we do it and all that kind of thing. So we've asked for some questions from our audiences about some pelvic health questions that you might have. So let's just jump right into it. I believe I have a rectocele. Are there exercises I can do at home to help it? So before we actually answer that, for those of you that may not know what a rectocele is, basically that's where, so you have the rectum, and that's where your poop comes out, right? The rectal, that's where the poop is stored and it comes out the anus. A rectocele is where it actually starts, that wall, the rectum and the vagina share a wall, and the rectum actually starts collapsing into the vaginal canal. And it can be a little collapse, or it can be a big collapse where you actually have a bulge coming out of your vagina. There's different symptoms that you may have with that. You may have difficulty emptying your bowels. You may have pain emptying your bowels. You may feel like you can't get it all out, and you might even have to like, let's say this was the vaginal canal, you might even have to like insert a finger and kind of push that pouch back up and over. So those are some of the symptoms that you may have. So let's talk about some tips and things that you might be able to do at home. What exercises would you recommend, or what? And I think we're going to cover not just exercises, but what would you recommend for a rectocele?
Yeah, I think that's a really good question, and thanks to whoever submitted it. I think that a lot of people are quite relatively happy talking about urinary symptoms, maybe female urinary symptoms. We know that it's a very common condition to have urinary symptoms. We know it's not normal. It should never be deemed normal. I think what people are a bit more reticent or reluctant to talk about is kind of bowel symptoms, or maybe even those symptoms of pressure or prolapse or that kind of vaginal pressure. I think it's trying to maybe work out, well, or have it explained why that condition has occurred. So whether that's due to maybe chronic constipation, it's quite common in chronic constipation, and trying to maybe seek help for that. It may be that it's maybe peri or post-menopausal, or it may be that at some point that it may track back to if that woman has had children, it may be that there has been that they've maybe had some birth trauma in terms of maybe a 4th degree tear, and that tear will involve that sphincter around the bowel having to be repaired. Because I think what I find is that sometimes women can have these quite marked things happen during that birth process, but it's not really explained to them. So I think it's trying to look at, well, why have I developed this? I think that's one, and I think, you know, your gynecologist should be able to do that, but sometimes I suppose they are more interested in maybe the surgical repair of the condition. I think there's generally a move away from surgical repair as a first line. I think there's a much more emphasis on conservative management initially, where I think then it's a case of trying to find that brilliant local pelvic health specialist, but a pelvic health specialist who specializes in prolapse, and ideally someone who specializes in prolapse and bowel dysfunction. And I think in COVID-19, I know here in the UK, all of the pelvic health clinics have really stopped seeing face-to-face, but we now see online. So it may be that if you're somewhere where you're thinking, well, the clinics are closed, I can't see my pelvic health physio, or I would like to see a pelvic health physio, but I can't because they're closed. A lot of clinics will be doing online appointments, you know, a bit like we're doing here, Jeanice. But I know in some countries, like where Jeanice is from in Texas, that clinics are still open. So I think it's trying to seek a specialist who has expertise in that. And I think sometimes it's being able to ask the questions and say to that person, well, you know, how much is this something that you routinely see, so that you're sure that you're seeing the best person for you. I think in terms of a retroceal, it's working out what's happening in terms of kind of the toileting mechanics. That's kind of a glamorous way or a technical way of saying, well, you know, what position are you pooing in? Wow, I love that. I'm gonna have to get one of those. Actually, I think my daughter may have some Sylvanian ones. They're not that. It was
in the kids section.
So one thing that is quite useful is that is having a look on YouTube. At the squatty potty video, because that's like it's a unicorn that's having a lot of constipation, so a lot of stress around that bowel, and they put the unicorn with a kind of a stool under its feet. So that really helps. And I'm sure you if you put in squatty potty unicorn, that video will just pop up. I think another thing that's good to do is to work out, well, is it kind of activity dependent? So are there things that woman is doing where that's causing more of that pressure? That may be in terms of maybe some physical activity, some sporting activity. And, you know, I think we're both very pro activity and pro exercise, but it's almost the right type of exercise at the right time for that woman. So that may involve a bit of dropping down intensity, bit of a shift to change exercise, because it's, you know, it's not normal to be getting those type of symptoms, particularly on activity. And also working out, well, what's going on with the structures, the fascia, the pelvic floor, the abdominal muscles. What's going on with those muscles? And it may be that a lot of people think, well, a lot of people think, well, I need to strengthen, I need to strengthen. And it may be that they do need to strengthen, but it may also be that initially they have to do some work to relax those muscles first. And how do you decide that? I think at the minute, it's probably working out, well, is there also a lot of pain possibly? If you're getting lots of pain also, that may indicate a degree of overactivity. So you initially maybe do some relaxing work for the pelvic floor, and then progress to doing the strengthening. If it's a case that there isn't really any pain and it's maybe that those muscles need to work a bit better, it's trying to get women to do some fast pelvic floor contractions, some slow pelvic floor contractions, but trying to get them doing this in functional positions, in weight bearing, in lunging, in squatting. And then what Jeanice is really good at also, well, she's good at lots of things, is you can talk us through some of the supportive garments.
Yes. Okay, so we have here this is called a hideaway, but there's different options out there. But basically this gives you some really nice support there for the perineum. And that would be worn under your outer clothes, but over your underwear. So that's one option. Another option, there are some exercise shorts out there that actually have
these are brilliant.
built-in perineal support here. So let me show you that. So you can see, like, it's reinforced here to help support the perineum. And these are from our friends Yvonne at EVB Sport. And so those are really nice options. Now, if you don't have the ability right now to go out or to order online, you know, something extra, because I know times are very tight. I would go to your closet and look at what you have in terms of exercise leggings. So kind of my guide is like, if your exercise leggings are kind of look at how jiggly like your bottom is in the exercise leggings, okay? So if you're having a lot of jiggle and movement, then your organs are probably jiggly, and we wanna support them, okay? So look for some exercise leggings that might have more support and more compression, and that can potentially give you some relief during activity. I also really like internal support too. So it can be, you know, I always recommend that you follow manufacturer's guidelines, and I'm not suggesting, you know, basically this is a pessary. So a pessary would be fit by your GYN, or sometimes physiotherapists do it too. Not very often in the US though, but I know in other countries they are. But basically this is something that goes inside your vaginal canal to help give it support. And then there's other options that look like this. There's this little squishy thing here called the Poise Impressa. You insert it kind of like a tampon. It helps some people kind of with support. And then some people even find that tampons, inserting them into the vaginal canal, can help. So again, follow the manufacturer's guidelines, discuss it with your healthcare provider. This is general information. It's not specific medical advice for you, but those are some options for support. And I just would encourage you to listen to your body. So yeah, maybe you want to run 5 miles or whatever it is, but if you're having symptoms from mile 4 to 5, maybe you're not ready to do that. So like Gerard was saying, like, you need to scale back, build strength, build endurance. That doesn't mean you're never going to be able to run, you know, over 4 miles, but you've got to build into it and listen to your body. So if you're having pain, if you're having that vaginal bulging or pressure and heaviness, that's your body's warning sign to you that it may not be ready to do what you're doing. So build up to it. And if you don't have the tools alone, then connect with somebody online. So, I mean, this one question could be a whole hour interview on its own. So we're giving you an overview. I would encourage you to go to my website, mypfm.com, click on Get Help, and then click on About My Body. And then you'll see like a circle of infographics. And on each of those, like it'll say postpartum or prolapse or bedwetting or whatever it is. Click on that, and then that takes you to a ton of resources. And if you had any questions, I'm happy to help connect with you. And I know Gerard is too. So, Okay, how do I handle my overactive pelvic floor and vaginismus during this stressful time? So let's first, just for somebody that might not have heard about vaginismus, let's talk about what it is and then what are some simple things that they can do at home.
Okay, so this is really a state where someone is getting the typical symptoms that someone may present with is what we would commonly term pelvic pain. So the woman is complaining of either maybe vulval pain or clitoral pain or internal vaginal pain, and that also will tend to lead to dyspareunia or pain on anything being inserted into the vagina. So that may be where someone is masturbating, where someone is using a tampon, where someone's having an internal examination, where someone's having penetrative sex. So that becomes very painful to do. And I think that, you know, we talk a lot that lots of conditions are really common, but pain and intimacy, whether that's self-intimacy, whether that's intimacy with a partner, that should never be painful. And also it should never be accepted that that's painful. And hopefully we are starting to move beyond that state that we used to have, where people were almost said, well, you know, this is what happens. And,
Yeah,
and it's just it's just an awful state. It's an awful state. And what's going on with that condition? Well, there are some kind of local tissue changes. You can get some muscle overactivity, and some of those muscles form almost like a collar around the vagina, so they can sometimes get a little bit overactive and closed off and compressed. Those muscles can also, if they're quite contracted, can generate pain. It's a bit like if someone is doing 8 hours a day at a computer and their shoulder muscles are working too much, that eventually would lead to kind of muscular pain in that shoulder. It might lead to muscular pain up into the back of that head. So you can get pain from those muscles. What you can also get is that tissue can become very hypersensitive. So normally if I kind of, you know, touch the back of my forearm, that will feel like kind of light, comfortable touch. Whereas if I had kind of pain there for some time, that light touch could become very painful, which is like an allodynic response. And the same happens both in that kind of those external genital tissues and internally. So you almost get like this kind of emerging pain state where normal sensation becomes quite painful, quite uncomfortable. What tends to also be really difficult about that condition is getting help for it. A lot of times people, and rightly so, will have a lot of medical investigations, which is really important to have, but then they can be told, well, actually, we don't really think there's too much wrong. So, but this woman is getting lots of pain, and that then leads to even more anxiety, even more kind of psychological aspects, and it's made much worse by that kind of stress and anxiety, because we know, like, and that's particularly relevant now in COVID-19, because our levels of anxiety or stress are much higher, especially if people are, you know, watching CNN or Fox News or the Trump press conference. You know, those things generally tend to create a lot of more stress and anxiety, a bit like we have here in the UK. So it's quite expected that those conditions may be worse at the moment.
Yeah, that's good. I think that you can't undervalue that, and just because you've had a doctor say there's nothing wrong doesn't mean that there's nothing wrong. So just because they're a doctor, they may not know everything, or they, you know, they may not have had experience with pelvic health physical therapy and the different options that we have. Because I can't tell you how many times I've had people say that their provider told them that it was in their head, or their provider told them to drink a glass of wine and just relax. It's way, way, way beyond that. So don't feel like, even if you've been told by a provider that there's no help and that it's all in your head, there is help and there are a lot of options. One of my favorite kind of self-help tools, because that's really what we're looking for. If you go onto Amazon, it's a book called Sex Without Pain. It's by my friend, Dr. Heather Jeffcoat, and she really walks you through a whole pelvic pain program with vaginismus and dilators. So again, this small segment that we're doing, we don't have time to get into all of that, but check out that book on Amazon. It's well worth, you know, the investment and really understanding your body and what's going on with it. And then if at all possible, get connected with a pelvic health PC.
And I think a bit like, you know, Heather's done some great work, a bit like you generally find that that a lot of these women may have had multiple kind of GYN medical consultations, but when you ask them, well, what do you understand what's wrong? Sometimes they're saying, well, I'm not really sure, but I've got a lot of pain. So the more information, the more insight, the better. That helps start that process of starting on that kind of to get some help in recovery.
Exactly. Good. Okay, so another question here. I think we'll do 2 more questions. So any preventative strategies to keep a healthy pelvic floor healthy through the years? What would you recommend as a daily regimen for somebody, or a weekly regimen for somebody that isn't having symptoms?
Right. I think that if you see enough patients, which, and you know, we both see lots of patients, if you see enough patients, patterns emerge. And in terms of pelvic pain, one pattern that emerges is that a lot of these women, not them all, but a lot of these women are women who maybe work intensively, work big hours, have high levels of stress, maybe are balancing work, home, family, or looking after another relative, or they're doing high intensity exercise. So they're switched on all the time, and that tends to be a pattern of behavior that we see a lot in pelvic pain. So things that might help, like we cannot say that this will maybe lessen the likelihood of getting pelvic pain, but trying to take a bit of time out to do some stuff that takes you out of that almost like sympathetically stress-driven routine 24/7, whether that's yoga, whether that's a bit of cardiovascular exercise, but not the really intensive stuff where you're just pumped all the time, doing a hobby, just trying to take time for yourself is good. And a lot of people struggle with that, whether that's meditation, mindfulness, headspace, time for yourself, time out. And I think in a way, like, you know, COVID-19 is, you know, it's a terrible thing that's happening, but one side effect of that, now that we're probably week 5 in it here in the UK, is people are starting to value things like going for a walk, having a cup of coffee, preparing a meal, spending time with their either family, or speaking to a neighbor from 2 meters away. Things that we maybe didn't value as much because we were always doing something. So that, I think that's one thing we see. In terms of pelvic health problems in general, we know what the risk factors are for those. One of the big risk factors of those is being overweight. And I think no matter what country you're listening to, whether it's Ireland, whether it's the UK, the States, you know, we have an obesity problem. We had some, the figures are quite horrifying, really, and that's now trickling down into our kids. So, you know, people who are overweight, that's a big risk factor for pelvic floor dysfunction. And addressing that has multiple health benefits, but it also lowers your chances of having pelvic floor dysfunction. The other thing that's probably that people always promote as kind of as a good thing to do is taking some general exercise. And I think the guidelines are about trying to do about 150 minutes a week. And a lot of people will do lots of exercise, but there's lots of people who do no exercise. So that's also, and I think the other thing is that if most women will put off seeking help for pelvic floor conditions until things are really, really bad. There are exceptions, but until suddenly they feel that actually that pressure that I was feeling in my vagina is now much worse.
Yes.
Or those problems I was having with my bowel movement, I now feel that I'm not going to social events because I feel I can't poo anywhere except in my own house.
Yeah, exactly. And I'm afraid of leaking.
Or that leakage is now stopping me from doing any exercise. Or, you know, I was having pain on intimacy, but now I really dread that because it's so painful. And I think it's to try and encourage women to, you know, put themselves first and trying to seek help a little bit earlier. Because if we can see these conditions earlier, they're a lot easier to treat.
Yeah, exactly. So overall, a healthy, balanced lifestyle. Avoid the things that you know are bad for you. Do the things that you know are good for you. I'm not aware of any research that says exactly you need to do X amount of pelvic floor muscle exercises.
I don't think that's our thing.
You know, but we want you to be connected with your pelvic floor. We want you to know how to correctly contract it. We want you to know how to relax it and incorporate it in your activities sometimes. Voluntarily, you know, it's automatically engaged when you're doing things, or it should be. And if it's not, then you're going to have symptoms. But even if you're not having symptoms, sometimes just thinking about breathing and recruiting, I think is a really nice mind, body, pelvic health connection. So,
and especially important at the moment.
Yes, exactly. Okay, so we are out of time for this segment, so we're going to go ahead and wrap up. Thank you guys so much for joining us. We know that we didn't get to all of the questions, but we thank you for submitting them, and we'll do this again. And if we didn't answer a question, feel free to reach out and we'll be happy to connect with you. Thanks again. Thanks, Gerard, for joining us.